you, Shannon, and thank you everyone else for being with us today. Good morning. I'm Lupe Alonso Diaz, and I'm very proud to serve as the President and CEO of Physicians for Healthy California, also known as PHC. As a mission-driven organization dedicated to improving community health, growing a diverse physician workforce, and promoting health equity, I'm honored to be standing here at one of California's physician residency programs. I'm honored to have esteemed guests standing here with me today who are also working toward that mission. While California continues to make strides in state-of-the-art innovation and medical technology, we are still faced with the harsh reality that people have trouble accessing healthcare. The root of this problem is that we simply don't have enough healthcare providers to meet the needs of Californians, and that is especially true of those patients who rely on California's Medicaid program for health insurance. PHC administers two critical programs that are dedicated to improving access to care in California and meet the needs of our utmost risk patients. CalMedForce is a partnership with the University of California and PHC to increase the number of available medical residency slots in California's underserved communities. Each year, the program awards grants to graduate medical education programs like the ones at Clínica Sierra Vista in Bakersfield and Arrowhead Regional Medical Center in San Bernardino to create or expand residency slots for doctors in training. Each one of those residency slots is critical when you consider that physicians typically settle long-term where they train, and that just one primary care resident can conduct approximately 600 patient visits per year. Cal Healthcare supports and incentivizes physicians to increase participation in the Medi-Cal program by offering student loan repayments if they have a caseload of at least 30% Medi-Cal patients for at least 5 years. We happen to have two current Cal Healthcare's awardees on the call with us today who are treating Medi-Cal patients in the San Joaquin Valley. Dr. Ninos Adams, a psychiatry specialist at Kern Behavioral Health and Recovery Services, who will speak to us in a moment, and Dr. Ungad Kalon, a psychiatrist at Kern Medical. He's also the Behavioral Health Inpatient Medical Director and Associate Program Director of the UCLA Kern Psychiatry Residency Program. Cal Healthcare is such an important program because a typical physician in California graduates with more than $300,000 in educational debt. Without this program, it would not be economically feasible for many physicians, especially those who grew up without wealth, to serve high needs and low-income patient populations and pay these debts off. From the start, Cal Healthcare has helped 1,119 physicians and dentists pay off their student loan debt, totaling $265 million. Last week's deadline to apply for these programs was met with unprecedented demand. The good news is that physicians in these programs will help to fill that physician shortage that the Inland Empire and Central Valley feel most acutely. The bad news is that we need to evaluate additional funding opportunities for these programs to expand the number of providers getting assistance. In fact, for the application deadline that just closed last week, the bucket of funds that providers could apply for was $63 million. However, more than $200 million was requested or applied for by providers. I couldn't be prouder of the work that PHC does to help graduate medical education programs to ensure patients in those areas have access to the care they need. Now I'd like to introduce Dr. Jasmeet Bains, who we are so very lucky to have in the State Assembly. Dr. Bains is a family physician who completed her residency at Clínica Sierra Vista. She's dedicated herself to increasing access to healthcare by treating underserved communities in the Valley. And she has a deep understanding of the complexities of these issues and how we must address them. Assemblymember Dr. Bains, so honored to have you.
Good morning, everyone. Thank you so much, Lupe, for holding this press conference on such an important issue to all of California and specifically to my home of Kern County in the Valley. I am Dr. Jasmeet Bains, and I very proudly serve Kern County in the State Assembly. I grew up right here in Kern County, been here my entire life, and returned after medical school, fortunate enough to serve my residency at Clínica Sierra Vista. Like the majority of other physicians, I chose to begin my career where I did my residency, right here in the Valley. But there are very limited opportunities to do what I did, and we lose hundreds of potential physicians every year. That is unfortunate because serving as a physician here, I have seen firsthand the severe shortage of providers. The Valley has 22% fewer primary care doctors than the state average. We saw this very well because I was the chair of the California Healthcare Workforce Policy Commission as a gubernatorial appointment as well. It's a public health crisis that equals poor access to care. It's even more pronounced amongst Medi-Cal patients because reimbursement rates are so low that it makes it difficult for providers to take Medi-Cal. And since the Valley has one of the highest shares of patients on Medi-Cal in California, the shortage hits patients here especially hard. The shortage equals poor access and delayed healthcare. And we know that all too often healthcare delayed means healthcare denied. That is why the programs that we are talking about today is so near and dear to my heart. The Cal Health Cares and CalMed Force programs have shown real results in the Valley, enticing young physicians to treat more Medi-Cal patients while ensuring new physicians are able to train with the local patient population. CalMed Force has funded 252 new and existing residency positions in the San Joaquin Valley, 37 in Kern County alone. Since most residents stay and begin their careers where they train, this has been an enormous opportunity to recruit physicians who understand our needs to serve our community, like me, myself. This invaluable assistance relieves physicians of an enormous burden, allowing them to dedicate themselves to our growing Medi-Cal patient population. Cal Health Cares has provided over $8.3 million in loan repayment for 32 primary care physicians practicing in the San Joaquin Valley, as well as nearly $7 million for 27 specialty physicians. Thank you everyone here for joining and addressing this critical need. At this time, it is my great pleasure to introduce my dear friend and also past co-colleague as a resident, Dr. Olga Miave, the incredible CEO of Clinica Sierra Vista and the Rio Bravo Family Medicine Residency Program, which is where I completed my program. And I very much am so proud of you, Olga, Dr. Miave, and I look forward to your continued leadership.
Thank you so much, Dr. Bain, for the great introduction. It is great seeing you. And thank you for being here in such an important issue. Like Dr. Bain said, my name is Olga Miave, and I am a family medicine physician, and I'm the CEO here at Clinica Sierra Vista in Kern County, and the DIO of our residency program, Rio Bravo Family Medicine Residency Program. As both Dr. Bain and Lupe have outlined, California has a severe growing physician shortage, and we really need to address it and do more to fix it. The San Joaquin Valley suffers from a particular severe physician shortage with 22% fewer primary care doctors than the rest of the state of California. And also the San Joaquin Valley has the lowest ratio of specialty per 100,000 in population. So to give you an example, there's just 81 specialists per every 100,000 people in this area, compared to the rest of the state, where the average is 131 per 100,000. And that is very significant and definitely impacts the health and the well-being of our Californians. The physician shortage has very real consequences for patients in our community, and it takes longer for patients to see providers and to be referred to specialty care. And they often need to drive long distances to those appointments as well, which is also a big barrier. This is especially true for our Medi-Cal patients, which is who we focus to serve here at Clinica Sierra Vista. This is one of the reasons why I'm so very proud of the work that we're doing here at Rio Bravo Family Medicine Residency Program. we have a teaching health center sponsored by Clinica Sierra Vista and with the affiliation of the Department of Family Medicine of UCLA. Our residency program started in July of 2014, and with the help of financial support from MedForce, starting in 2019, at the beginning of COVID, we were able to increase the size of our program from 6 residents per class to 8, for a total of 24 physicians. This group of residents see over 12,000 patient visits a year. And we do all of that at our East Niles Community Health Center, which is our teaching health center. And we do this while we train to become board certified family physicians. So far, our program has had 39 graduates, Dr. Baines and myself included, and we have an amazing 51% of those physicians stayed in the Kern County area in the Central Valley, and they continue to serve our patients, our friends, and our neighbors. Equally remarkable is the fact that 59% of our graduates are members from underrepresented minorities. And despite the new pipeline of primary care physicians, the effects of the pandemic have caused ongoing strain in the already overstretched healthcare workforce. The population of Kern County continues to grow, and older physicians have decided to retire during this difficult time, and they continue to do so faster than we can replace them. Through the partnership with CalMedForce programs, we have been able to diminish the impact, but we need to do more. It is essential to continue growing teaching health centers and training programs. Our goal is to grow this program so that we can better meet the needs of our community, and we hope that CalMedForce will continue to partner with us in these efforts throughout the years. Now, it is my great honor to introduce the next speaker, Dr. Ninos Adams, a psychiatry specialist at Kern Behavioral Health Recovery Services and a fellow resident from my time. So thank you, Dr. Ninos.
Thank you, Dr. Milve. Thank you so much. Thank you, everybody. Good morning. I'd like to start out by saying thank you to Cal Health Cares for helping us provide the care that we need to provide here in the Central Valley, where I was born and raised, and I'm happy to continue serving the population for the psychiatric needs. It's been a difficult thing for a lot of graduating residents who are burdened with significant loans and wanting to help the community, but also having to meet the demands of those loans, which is difficult. And with Cal Health Cares and the help that they provide, we, and including myself, have been able to stay and serve this population, thereby helping these patients get their appointments and not have extended wait times, which they are subject to, and thereby delaying care and worsening their prognosis. So hopefully this program can continue to expand so that we can help all of our friends and neighbors moving forward. Again, thank you to everybody. I have the pleasure of introducing Dr. Shannon next.
Thank you, Dr. Ninos Adams. I'm Dr. Kevin Shannon. I'm the Chief Academic Officer at SAC Health. This is in San Bernardino, in the Inland Empire. I'm also Program Director in the Loma Linda University Health Education Consortium called LUHEC, and I'm a practicing family doc. As Lupe and others have outlined, California has a significant physician shortage, and I understand it's projected to get worse with over 11 million Californians now living where there's a shortage of docs, primary care docs specifically. It's especially pronounced here in the Inland Empire, where we have the state's lowest ratio of physicians per population, according to a 2021 study. We have only 41 physicians per 100,000, compared to the statewide average of 60. So it's about a third less. We also have the second lowest ratio of specialist physicians to population. That's also about a third less than the state average. So significant issues. The practical impact is when I, as a primary care doc, want to get my patient to a specialist, they've got to wait to get an appointment. They've got to travel a long way. And it's even more pronounced if they're Medi-Cal. They're Medi-Cal, well, it's hard to get take on a new patient that doesn't pay as well as commercial. Just a practical reality. So with the help of state CalMed Force and federal THC GME grants, we at SAC Health are able to provide just beyond 400 residents and fellows each year with their continuity clinic experience at our state-of-the-art, patient-centered, medical home certified, federally qualified healthcare setting here, where we are able to supervise all those residents and fellows with academic physicians from Loma Linda University. This teaching health center provides them with a positive example of how to provide care for Medi-Cal patients. So many of them stay and practice with us. In fact, 74.9% of our primary care graduates go on to practice in California, and close to 1/3 of our graduates stay right here in the Inland Empire to practice. Our CalMed Force supported LUHEC residents are the regular physicians for Medi-Cal patients. They provide high quality OB care, then find preventive care for the babies, medically assisted therapy for addictions. They play a key role in taking care of diabetes and other chronic conditions. They're a key cog in the wheel for us here. Providing funding by the state through this CalMed Force has allowed us to expand family medicine, but not just family medicine, my own specialty. CalMed Force has funded 91 residency positions for us here at LUHEC across 6 specialties: family medicine, pediatrics, internal medicine, OB-GYN, med-peds combo training, and emergency medicine. The Inland Empire already suffers from a shortage of healthcare providers, but the recent growth in population around here is driving that demand up even further, particularly for patients relying on Medi-Cal. So CalMed Force funding helps us to meet that demand by ensuring that we have enough trained physicians who are able to hone their skills right here in our community. It's a big deal for us, and we're very thankful.
Thank you so much, Dr. Shannon. And now this is the conclusion of our press conference. I will kick it back over to Lupe to close us out.
Thank you, Shannon. Again, I want to thank all of our wonderful speakers today. You truly embody the spirit of leaning in during the pandemic, leaning in, particularly in communities that are most underserved. So we appreciate you, we value you, we honor your service. And with that, thank you again for attending our press event today. Have a wonderful day.